Today, we're diving into how the transition from student life to working life can be overwhelming for new nurses, and how a system
Yeah,
called the STAR model can, help ease that process. Let's get started.
I'm really intrigued by this. So, new nurses are finding the transition tough?
Absolutely. Many new graduates feel they're, thrown into the deep end without enough preparation.
Mm-hmm.
They often don't feel equipped to handle their new responsibilities.
I can see how that would be challenging. What's causing this feeling of unpreparedness?
While the gap between theoretical learning and practical application is significant.
Yeah.
Also, the high expectations and complex tasks can be, daunting.
So, how does the STAR model come into play?
The STAR model is a systematic mentorship approach developed from a master's thesis at the neurology department in Viborg Regional Hospital. It
Okay,
identifies 5 key areas where mentorship can support new nurses.
5 areas? Can you elaborate on those?
Sure, they are. The transition to working life, guidance and support,
Right.
learning and self-development, managing professional expectations, and socialization with colleagues.
That seems comprehensive.
Exactly. The idea
Yeah,
is that if one area is neglected, it can affect the others. It's about holistic support.
that's smart. How is the model implemented in practice?
They've integrated it into the introduction programs for new nurses. Mentors and mentees use the model as a reflection tool to guide their
Mm-hmm.
interactions.
So, regular meetings and discussions?
Yes, and it's tailored to each individual's needs. The mentor helps the new nurse navigate challenges, provides
Right.
feedback, and supports their development.
That sounds supportive. But do you think having such a structured program might be overwhelming in itself?
That's a valid point. However, the structure actually provides clarity and helps new nurses know
Mm-hmm.
what to expect.
I suppose having clear guidelines can reduce anxiety.
Exactly. It creates a safety net so they're not left to, figure everything out on their own.
That's reassuring. How have the new nurses responded to this model?
Feedback has been positive. They feel more confident,
Yeah,
supported, and report better well-being.
that's great to hear. Does it also improve retention rates?
Yes, it seems to help with staff retention. When nurses feel supported, they're more
Right.
likely to stay.
Makes sense. High turnover is a big issue in healthcare.
Absolutely. And
Yeah.
mentorship programs like this can make a real difference.
You mentioned process tools like the improvement model and the PDSA cycle. How do those fit in?
Great question. They use these tools to develop and implement the mentorship programs systematically. It ensures
Okay.
continuous improvement.
So plan, do, study, act cycles?
Exactly. They plan the mentorship activities, implement
Right.
them, study the outcomes, and adjust accordingly.
That's a solid approach. It allows for flexibility and adaptation.
Yes, it's all about
Yeah.
refining the program to meet the needs of new nurses effectively.
Do you think such a model could be applied to other professions?
Definitely. The challenges of transitioning from student to professional life are common across fields.
So mentorship could be beneficial universally?
I believe so. Having a mentor to guide you can bridge the gap between education and practice.
Right. That's a good point. But are there enough resources to provide mentors for everyone?
Resource allocation is always a challenge,
Yeah.
but investing in mentorship can save costs in the long run by improving retention and job satisfaction.
True. Happy employees are more productive and less likely to leave.
Exactly. It's about valuing and supporting staff.
I wonder if the model addresses work-life balance and burnout prevention.
Well, by providing support and guidance,
Mm-hmm.
it's likely to help reduce stress and prevent burnout.
That's important in high-stress jobs like nursing.
Absolutely, the mentorship
Yeah.
helps new nurses manage their workload and expectations.
Do the mentors receive training as well?
Yes, mentors are trained to provide effective support.
Right.
It's essential they have the skills to guide others.
That makes sense. You can't have mentors who are unprepared themselves.
Exactly. The success of the program depends on competent mentors.
Overall, it seems like a comprehensive approach.
It is. By addressing multiple aspects of the transition,
Mm-hmm.
it maximizes the chances of success.
I like that it's adaptable to individual needs.
Yes, personalization is key.
Yeah.
Everyone's experience is different.
Do you think this model could be used internationally?
I don't see why not. The principles are applicable globally.
That's promising. It could help many new professionals worldwide.
Definitely supporting new staff is
Mhm.
crucial in any industry.
Well, this has been a really insightful discussion.
I'm glad you found it interesting. The STAR model is a great example of how targeted support can make a big difference.
Absolutely. Thanks for sharing all this information.
My pleasure. Hopefully, more institutions will consider implementing similar programs.
Agreed. It's all about supporting people to succeed.
Exactly. Well, that wraps up our discussion for today.
Great conversation. Looking forward to our next topic.
Me too. Until next time.